Hello, my name is Jeff Jaeger, and I am a BSN student enrolled at the St. Petersburg College of Nursing. This presentation will analyze the community health needs of the City of Clearwater. After a brief glimpse into the city's history, we will begin to review the elements of the community and its residents that ultimately affect the overall health of the City of Clearwater, and also identify any issues or areas of improvement that may positively impact the city. The first known inhabitants of Clearwater Bay were the Tocobaga Native American tribe, who settled the region in the 1500s. That is, until the U.S. Army Corps of Engineers elected to build a stronghold known as Fort Harrison along Clearwater Bay in the 1850s during the Seminole War. After the war ended, in an effort to encourage land ownership and agricultural growth in the area, the federal government offered land grabs for U.S. citizens within the areas of Pinellas County, which would eventually become the City of Clearwater. Henry Plant brought the railroad to Clearwater during the 1910s. The railway put the city on the map, and later it became a popular winter home and vacation destination for many. Shortly after, a post-World War I construction boom in the area drastically increased the city's population. Then, in 1948, the Philadelphia Phillies chose Clearwater as a spring training home. The city of Clearwater could be described as an urban area with over 47,000 housing units, with an ownership rate of around 57%. The housing units are made up of a wide range of properties including family homes, condominiums, apartment complexes, retirement communities, and mobile homes. During the windshield survey, it was noticed that the majority of the homes were in relatively good standing condition and structurally sound. According to the Pinellas County Health Department, there are 8 homeless shelters, 6 food pantries, and 3 different low-income housing programs to assist those in need within the community. There appears to be sufficient support and community resources allocated by the city and surrounding government agencies, but there is still significant room for improvement. According to the U.S. Census Bureau, 15.8% of the residents of Clearwater live below the poverty line. This percentage is greater than that of the county or the state. So clearly, the 8.6% of homes that are vacant within the community should be offered as places to live for those in need. This is a potential area of opportunity for improvement for the city of Clearwater when it comes to the utilization of structures within the city. A second area of concern regarding structure was noticed during the windshield survey. A large amount of manufactured homes have been noticed within the city limits. Of the 107,000 residents of Clearwater, 24.1% are under the age of 18, while 21.4% are 65 years or older. Seasonal residents who spend their winter months in Clearwater number over 6,000. The median salary for a family of 4 is just under $45,000 a year, which is below both the county and state average. And while 58.8% of the community is employed, which is above the county and state average, 15.8% of families live below the poverty line. In short, more people are working in Clearwater, but making less money than the average citizen in the surrounding communities. Clearly, there is a disconnect somewhere. Do high-paying jobs not exist in Clearwater, or are other factors to blame? Perhaps a lack of education is the culprit. According to the U.S. Census Bureau, only 27.4% of Clearwater citizens have a bachelor's degree, while 30% of Pinellas County residents do, and 28.5% of Floridians. Of the top 8 reported communicable diseases within the city of Clearwater, 5 are sexually transmitted in nature. This is a major issue. An overall lack of education or limited access to contraceptives is negatively impacting the health of Clearwater. Based on these numbers, it is clear that there is a limited knowledge of healthy lifestyle choices, and more specifically, safe sex practices within the community. Still, there is another issue. According to a 2016 independent research study, drug overdose was the 6th leading cause of death within the city. As previously mentioned, the city of Clearwater has 2 major hospitals within the city limits, as well as numerous primary care physicians, specialists, and urgent cares. It is also home to a number of rehabilitation centers, assisted living facilities, and other medical centers. But is access available to all the citizens? For the residents of Clearwater, the answer is actually yes. The Clearwater community has a number of low-cost and even free health centers within the city limits. The Clearwater Free Clinic offers a wide range of services including primary care visits, labs, diagnostics, ophthalmology, and pediatric sick visits for residents of northern Pinellas County. The Turley Family Health Center and Community Health Centers of Pinellas offer low-income families a wide range of medical care and even dental treatment. Healthy People 2020 aims to improve the overall health of our nation by the end of this decade, but this has to be done one community at a time. One objective of Healthy People 2020 is to increase access to healthcare services by increasing the number of community-based programs. The Clearwater community already has a great foundation on which to work on. The two major hospital organizations and community-based health clinics have allowed increased access to basic healthcare needs, but there is great opportunity ahead. Perhaps a public health advertisement campaign could be launched to get the word out about the resources available within the community. Another health issue that 2020 aims to take on is the spread of STDs. According to the group, an estimated 20 million people in this nation contract STDs annually, and if left untreated or undetected, a large number of easily preventable complications can occur. I believe that with an above average rate of reported STDs within the city of Clearwater, Clearwater stands to benefit a great deal from STD awareness and education. With proper education, screening, access to condoms, and safe sex practices, the residents of Clearwater could knock down the rate of STDs within the community. Finally, Healthy People 2020 aims to decrease the rate of heart attack and stroke within the U.S. by the end of the decade. This could have a positive impact on the city of Clearwater. According to a 2016 study performed by Baycare Health Systems, the owner of Morton Plant Hospital, heart attack and stroke are two of the top 5 causes of deaths by the residents of Clearwater. When it comes to the environment in and around the city of Clearwater, there appears to be no major issues. The city owns and maintains 10 different parks and recreational facilities within the city limits. Citizens can participate in sports, recreational activities, and physical exercise. Most of the parks are outdoors, but the Long Center, which is owned by the YMCA, offers indoor and outdoor activities to all citizens at an income-based cost. The Pinellas Trail, which offers a safe place to ride bicycles, run, or rollerblade, also runs through the city of Clearwater and is free to all residents. All of the resources provide residents numerous opportunities to maintain a healthy lifestyle at little or no cost. Residents have access to sufficient clean water, reclaimed water at a reduced cost, waste removal and recycling services. In the event of a water shortage, the city has the ability to borrow water from the county to bridge the gap. If a resident of the city of Clearwater were to have an emergency, the city would have you covered. The city has its own police force with over 180 officers and 6 different fire stations. The Sunstar paramedics also have the ability to transport residents to either of the 2 major hospitals quickly, responding to 90% of all calls in under 10 minutes. When it comes to government and public policy, the city of Clearwater is represented by a mayor and 4 council members, who must run for re-election every 4 years. The city council meets multiple times a month at the city library, and the meetings are open to the public. The meetings can be attended in person or streamed online. Following the meetings, the agendas are posted on the city websites. The council is tasked with determining the annual budget. The majority of the 2019 budget funds the utilities, waste, police, fire, and recreational departments. During the windshield survey assessment, the city appears to be well funded and maintained. Now that we have analyzed the community, let's assess the needs. The first is the poverty line. The percentage of people living below the poverty line within the city is above that of the county and the state. The average income for a family of 4 within the city is $5,000 a year less than that of the families of the state. This is concerning as a community health nurse because this may represent an increase in demand for free or reduced community health services. In order to care for members of the community effectively, the economy within the community must grow, offering higher paying jobs, or the number of community resources must increase. If neither happens, then the problem may only become more widespread. Second is the rate of STDs. As mentioned before, 5 of the top communicable diseases reported within the community are sexually transmitted. This is an alarming rate in the United States. STD infection rates should be on the decline in this day and age. The dangers of unprotected sex are taught to people at a younger age nowadays. Perhaps people within the community are uneducated, adopting risky sexual habits, or simply do not have access to condoms or basic health care screenings. Either way, the community should be concerned because there's a major chance for improvement in this area. Third is drug use. Drug use is the 6th leading cause of death within the community, and within the state of Florida, it's not even in the top 10 causes of death. This is an alarming number. The next major community health need within the city of Clearwater is a better understanding of cardiovascular disease. Heart attack and stroke are 2 of the top 5 killers in the community. Although these disease processes are normally progressive, they are preventable. risk factors can be reduced with diet and exercise. A significant impact could be made within the community with education and the utilization of the community's resources, i.e. parks and recreational centers, in order to keep people active. Morton Plant Hospital, which is located within the city limits, is a leader in heart attack and stroke treatment and prevention. A partnership with this non-for-profit hospital could spread the word about risk factors, prevention, and signs and symptoms of an acute attack. Number 5, education. The percentage of college graduates within the community is lower than the surrounding areas. Clearly, this is elevating the level of people living below the poverty line and decreasing family incomes. The usual path to higher pay is education. A recent Georgetown study found that the median income for a college graduate is $17,000 more a year than a high school graduate. Highly educated people are more likely to take care of themselves and have access to more resources. Finally, hurricane preparedness. The city of Clearwater lies along the heart of Florida's Gulf Coast, making the community at high risk for hurricanes. An emphasis on storm safety needs to be placed upon mobile home owners and also members of the community.